My name is Anne Marie Brescia. I am a pediatric rheumatologist here at Nemours Children's Health. I am the chief of pediatric rheumatology, and I also have a translational rheumatology research lab here. So I see both patients and conduct translational research. What we take care of the most in pediatric rheumatology is something called juvenile idiopathic arthritis. And so you may be surprised by that because many people don't realize that children get arthritis. They think it's just for older people. But actually, even little 1-year-olds get arthritis, which just means swelling and inflammation of the joints. And there are many different types of arthritis kids can have. What I do in the lab is try to answer the question of prognosis. So there are some patients with juvenile idiopathic arthritis, also abbreviated JIA, who start out looking like they're going to have a very benign, easy course. We give them mild medicines. And then there's other kids who show up with a very aggressive course, and we give them our strongest medicines to get it under control quickly. And that part's fine. There's this sneaky in-between group that looks like they're going to have mild arthritis at the beginning, and over the years, they show you that they actually have the more aggressive arthritis. No one has been able to predict early on which patients will have that prognosis and their arthritis become more aggressive. And it turns out by the time they show you that clinically, it's very difficult to get those patients' arthritis under control. So in the lab, what we do is we are trying to find markers, proteins in the synovial fluid, which means the fluid we take out of the joints as part of their regular treatment, to predict which patients will have that more difficult course. And now we're even expanding those studies to try to do blood tests for that, because not every patient would have maybe their knee drained to get that fluid. So really the overarching mission of our lab is to predict early in the course, before you can tell on the patient, which patient might need aggressive treatment early on to prevent this extension to the more aggressive arthritis. I feel that I've been very fortunate here that we have so many resources in Delaware to help young investigators succeed at starting up a research program. And so I have been lucky enough to have both the MRDA, the Mentored Research Development Award, early on that helped me work with my mentor and prepare a successful grant to be able to get a pilot grant on the Delaware CTR. And so that opened up a host of resources that I previously did not realize were available. So I participate through the Delaware CTR in the JIN, the Junior Investigator Network. And this is kind of a gateway with weekly meetings that let me learn everything that's available, connecting me to potential collaborators, other young investigators at other institutions where I might not even realize that something they're doing in a seemingly unrelated field ties into my research or something that we're looking at, and then we can collaborate together. We're looking to expand our lab, and we've been able to take in an undergraduate student who's doing tremendously well, and having extra person in the lab is allowing us to pursue some other pathways in the pathogenesis of JIA that will let us branch out into different areas in addition to doing the prognosis work. The advice I would give to any new investigator planning a career in research, just starting out their career in research, would be to find one, if not more, really good mentors with whom they really connect.